The Nigeria Centre for Disease Control and Prevention, NCDC, has confirmed that there is no case of Ebola virus in Nigeria, urging citizens, however, to be cautious. The centre, in its public advisory issued on Friday, noted that there were 2 recent suspected cases of viral hemorrhagic fever in Abuja, but both tested negative for Ebola and Marburg viruses. Ebola virus disease, EVD, formerly known as Ebola hemorrhagic fever, is a severe, often deadly disease caused by the Ebola virus with a fatality rate of 25 to 90%. The NCDC commended the action of the travelers and urged all Nigerians to emulate the same. Also, the Federal Capital Territory Administration has allayed fears of residents but warns them to be cautious. Let's now turn to the Director General of the Nigeria Centre for Disease Control and Prevention, Dr. Jide Idris, to further sensitize the public on this disease and possible preventive measures. Thank you for joining us. Dr. Idris,
good evening.
What measures can individuals take to protect themselves from this fever, especially considering the recent suspected cases in Abuja, though now tested negative?
Well, basically, people should understand how the disease is spread. Once you understand that, you can adopt measures to stop the spread. In the case of Ebola, you must have contact with a diseased person or an animal that has passed on the disease. In this case, it's only people who have the Ebola disease and are contagious. Once you know that you come across people with fever or symptoms that may make that, the best bet is to avoid them. Do not allow contact with any of their body fluids, whether blood, urine, etc. But that's the easiest way Ebola virus is transmitted. Once you can block that mode of transmission, people are sick. And the easiest way is to adopt this infection prevention and control. Simple hand washing, using hand gloves, clean your environment, and etc. And like you said, avoid people who are ill-looking or who have fever, or those of them who have traveled to areas where the Ebola cases have been detected. That way, you minimize your contact, and that way you don't catch the disease. And the easiest way is that once you feel sick, you don't know what it is, and you know you've traveled or been in contact with people who have this fever, report to the nearest health facility.
How effective are Nigeria's current health protocols in detecting and managing potential outbreaks like Ebola? I know in your presser you talked about some of this, but could you reiterate?
Hello?
Yes, I can hear you. I asked how effective Nigeria's current health protocols are in detecting and managing potential outbreaks like Ebola.
Let me say that the 2 cases, suspected cases we have actually tested our effectiveness and preparedness. Yes, our score is very high because they were easily detected. Luckily, too, the patient cooperated. He admitted himself to a hospital, and the doctor in charge that alerted the epidemiologist in the FCT who contacted us. So it's more like a teamwork. And everybody knows the protocol. I must say that all the various stakeholders involved did their work effectively, starting from the hospital itself, the patient itself, the epidemiologist FCT, the people who went to collect blood sample, and even the hospital, how they tried to isolate the person, and then the quickness with which the samples were taken and sent to the lab to confirm what we were dealing with. So everybody cooperated. Even the people at the port did their best because again we tried to trace the line. The passenger. We contacted the airlines. They got their line list. People he must have possibly come in contact with in the plane with the aim of contact tracing. But since the thing was negative, there was no need for that. What I'm saying is that all the people who were supposed to work did their work. But I must say again that we still have some gaps that we need to fill. We need to do better than we've done. But I must congratulate everybody here who did the job. If not, suppose the thing had been positive, would have been in a big mess right now.
All right, talking about public awareness, I noticed that in your press release, you really commended the traveler who reported himself after feeling unwell. People travel a lot in Nigeria. What should travelers be conscious of? Is it for countries that are prone to Ebola when they come back and feel unwell? Or is just generally when they come back from any journey and they feel unwell, they should report to the hospital?
To be Ebola, the same thing with last brother is saying, once you start having fever, that people generally treat for malaria. Most times it may not be malaria. The best thing is see a doctor or go to a health facility where they can do proper investigation and know what is happening. In this case, again, for purpose of Ebola, because to meet the standard definition, you must have been in contact with somebody who's had Ebola in the last 3 weeks, or you must have traveled to an area where Ebola has been detected in the last couple of weeks. And the standards we meet. Once we meet those standards, the normal protocol is initiated. But in this case, if you are a traveler, I know you've been to countries where Ebola has been detected, and you start feeling funny, the best is see the doctor, report to the nearest hospital for proper investigation. Do not treat yourself.
All right.
In this kind of thing, everybody has a role to play. The government, the people, the public health facilities, and even the individuals themselves have a role to play, so that everybody works together to achieve an effective response.
Yeah, talking about response, people are tested negative. Were they isolated? Is there a time frame that these people should stay isolated to be sure that they don't have it, or the fact that it tested negative is enough?
When they went to the hospital, he was isolated. We talked to the doctor to isolate them because we did not know what we were dealing with. We had a suspicion of Ebola. For that kind of thing, they need to be isolated. So that's what they did. And after taking the blood sample, they remain isolated on the result. The result is out. They don't just allow them to walk around. They must be isolated because it can affect other people.
All right, given the fatality rate of Ebola virus, what steps should the government take to enhance preparedness and response to such potential health threats? What further awareness measures can they also employ?
One, from giving awareness campaigns to the people to understand what Ebola is, how it is contracted, how it is spread. The other thing is that the government must set up public health facilities or infrastructure that can help us address this issue when it occurs. And that covers many things. One of them has to be with serious coordination. The activities must be coordinated in a way that there is no gap for any lapses. People who are supposed to do things must know what to do and when to do that. And that's what happened here. Starting from the port health services, the laboratory people who are on alert to do the test, the public health officials who went to the hospital, who took blood samples, who talked to the hospitals again what to do and what to do. So everybody does that. That's what coordination is all about. The other one has to be the infrastructure. Apart from the laboratories we have, all the laboratories again have been empowered, have been optimized to be able to cater for not only Ebola, but many other diseases, what we call integrated detection. That's one. And it's imperative for cases like Ebola that need isolation. We're imploring all state governments, all the states and local governments to set up areas where they can isolate people. So treatment and isolation centers are key, because once you have Ebola cases, they must be isolated until they turn negative. That's two. The other one, again, build the diagnostic facilities we are building at NCDC. We have zonal laboratories, we have national laboratories, and all of them are in contact again. The bit again has to do with teaching people how to deal with this when they occur. Ebola, there is no specific treatment. You only treat systematically until symptoms go down. But again, certain things again have to be taught, what to do, how to gown, people who are taking care of them, how to put on the PPEs. These are training that are ongoing, and how to even detect again the different labs again, so that they don't necessarily have to come to Abuja or Lagos before they can test. So what we are doing is that all that laboratories at zonal levels, whose facility we're optimizing so that they can test for many, many diseases. These are things that are ongoing. Yeah. And again, the other thing in terms of preparedness is that we stockpile materials we feel we may need for any particular disease. And stockpiling include drugs, PPEs, hand gloves, etc. All the things you probably will need, including vaccines, just in case it's a vaccine preventable disease. We stockpile this. We don't wait until this disease occurs before we start speaking for them.
All right. Thank you very much, Dr. Idris, for speaking with us.
Yeah, my pleasure.